field investigations and case management. To bolster frontline capacity, they have trained over 30 healthcare workers in diagnosis, treatment, and case management of leishmaniasis across the 4 affected centers. This is complemented by continuous medical education targeted on the job mentorship and training on case-based surveillance reporting through health information systems aimed at improving the data accuracy and timelines. To support the diagnostics and treatment, the Ministry of Health has distributed 768 boxes of a rapid diagnostic test, 850 vials of sodium stibogluconate, 1,900 vials from paromycin, 840 vials of ambisome. Those are actually the 3 drugs that are used in the treatment. An additional 200 test kits and 400 more vials of drugs were also procured using supplementary funds. Furthermore, in collaboration with the partners such as World Health Organization and Médecins Sans Frontières, the ministry coordinated the delivery of these critical health products and technologies to Wajir County to ensure uninterrupted availability of essential diagnostic and treatment supplies for the affected population. To strengthen inpatient cases, 100 hospital beds and mattresses were distributed to improve the quality of care and comfort in the treatment facilities. Importantly, 3 mobile laboratory units were deployed in the most affected sub-counties to facilitate timely diagnosis, treatment, and on-site data collection. In addition to these medical efforts, the ministry launched comprehensive vector control activities aimed at mitigating the spread of leishmaniasis by targeting sandfly vector responsible for the disease transmission. To this end, the ministry procured 50 farm guard masked duster machines, 150 Omni pumps, and 141 2-stroke engine sprayers. Basically, these are actually for spraying in the environment and spraying inside the houses. And also 1,000 sachets of insecticides for the same. These integrated vector management strategies are crucial to reducing vector density and lowering transmission. Also, on the long term, the ministry has continued in the recognition of the current nature of visceral leishmaniasis. The broader and more resilient public health systems in the ministry has initiated long-term measures aimed at sustaining progress and preventing future outbreaks. These include a national strategic plan. They've also provided resources through the supplementary budget, and this has been useful in containing the outbreak. Honorable members, looking forward, the ministry has worked out a plan with KEMSA to distribute the required drugs and equipment in the affected areas. And also, Mr. Speaker, in the long term, Kenya Medical Research Institute has played a central role and will continue to play a central role to actually monitor the disease outbreak, monitor responses for a long. This is not only for the regions affected, but for the country as large. So the ministry remains available to provide any further clarification that this Honorable House may require. Signed by the Honorable Minister Aden Duale, ECG, EGA Cabinet Secretary. Thank you, Mr. Speaker.
Kainan. Thank you, Mr. Speaker. Mr. Speaker, the answer given by the chair is comprehensive. But as usual, Mr. Speaker, most of it is theoretical. The Kala-azar outbreak, Mr. Speaker, is not a matter of yesterday. It has been there for years. And I'm sure in your other lives, even as a lawyer, as a magistrate, you know what happens in that particular area. Every year we are being told there is a strategic plan. Something is being done. Mr. Speaker, if we look at even the answer, 95% of all the Kala-azar reported cases actually are fatal. Wajir alone has over 762 cases. Ideally, it means it's something that we know health is devolved. But equally, Mr. Speaker, we also know that most governors, most county governments are also not prepared for this critical function. Therefore, it behoves upon the national government, notwithstanding this as a critical county function, to be always ready and be prepared to attend to these innocent people when they are infected by these Kala-azar, these sandflies. Mr. Speaker, this has happened. It has happened many years ago. It has happened last year. It's happening this year. Ideally, by now, we should have a rapid response team at the Ministry of Health headquarters that will always be ready actually to attend to any part that faces this challenge. So what urgent measures are you putting in place, or the ministry putting in place, to make sure such outbreaks don't recur again to any other part of the Republic of Kenya?
Thank you. Dr. Nyikal, what urgent measures?
According to this report, Mr. Speaker, they actually have a team, an epidemiology team, that is actually who actually respond. And this case, actually, they responded, and they started by actually training people, and that involved the county health workers. That's according to the report. And also purchase of the drugs and the test kits that were required, and also purchase of the equipment that is needed to spray both in the houses and also in the environment where people live. So those are really the measures that I could see in this report they have taken.
Honorable members, before the next order, allow me to acknowledge in the Speaker's gallery Pare Council of Elders led by Mzerama Lukindo from Taveta constituency, Taita Taveta County. Musimame, mushangiliwe. Asante sana. Munakaribishwa katika jumba la bunge na mkae kwa starehe na fasaha.